Moving on to the respiratory system, we get CP pod. CP stands for city park, or in this case, it is pain in chest and cough. And what is pod? Pod is PND, orthopnea, and dyspnea. Now, one thing you'll notice is that this is pod, not pods. That's because syncope is missing. We really don't have syncope windmill here. It's just pod, and unlike P pods, it's just a space pod. And you know whose pod is this? Well, it belongs to All Hail Vegeta, the Prince of No One. I mean, the Prince of All Saiyans. And that space pod has actually landed beside City Park. So we have the mnemonic CP pod. C stands for city, P for park, or in this case, C stands for cough, which we'll discuss later. P stands for pain in chest, which we have already discussed in the PEC show, and you'll find that under cardiology section. So without wasting time, if we discuss dyspnea, which is shortness of breath or just breathlessness, along with orthopnea and PND in extension, we can have a lot of causes. For example, respiratory causes, for example, bronchial asthma, COPD, pneumonia, pneumothorax, pleural effusion, pulmonary embolism, pulmonary fibrosis, interstitial lung disease. We can have cardiac causes, for example, pulmonary edema or congestive cardiac failure, or we can have metabolic causes, for example, DKA, we can have chronic renal failure, or we can have psychiatric disorders, for example, hyperventilation syndrome. Now, if you really come across a patient with a shortness of breath, you may want to ask the duration. If it's sudden or short, that's because of pulmonary embolism or pneumothorax. Well, in pneumothorax, the patient is more likely going to be thin, lean, or smoker, and short duration is also associated with bronchial asthma, pulmonary edema, and pleural effusion. Now, on the other hand, if the duration is long, that's because of heart failure or bronchial asthma, chronic bronchitis, or interstitial lung disease. That you may want to know about the onset. If it's sudden, that's because of pulmonary embolism, pneumothorax. If it's gradual, that's because of heart failure or asthma, or simply chronic bronchitis or interstitial lung disease. And if it comes in attacks and the interval between attacks is free, that's because of asthma or maybe hyperventilation syndrome. Then your next job is to assess the severity of shortness of breath. If it's grade 1, 2, 3, 4, just whatever is it, just write it down. Well, that's a great lecture on shortness of breath. Shall we continue to the associated symptoms? Oh yes, of course. So first of all, associated with shortness of breath, you might want to ask about the cough. As our Prince of All Saiyan is coughing, now the next question is, what's the significance? Well, good thing you asked. If there's cough with breathlessness and with scanty sputum, that's because of asthma. If it's with mucoid or mucopurulent sputum, that's because of chronic bronchitis. If it's frothy sputum, that's because of acute pulmonary edema. If it's very foul-smelling sputum, that could be because of empyema. Next, we draw elastic bandage around the chest of the Prince of All Saiyans. Looks like the prince got his arse beaten badly by a low-class warrior. Here comes Kaioken! So this elastic bandage around his chest is going to tell you about the chest pain. If there's chest pain and breathlessness, better think about the pneumothorax or pulmonary embolism or ischemic heart disease. Next, we're going to draw what? A monkey? A Saiyan monkey. Is that you, Gohan? Yes, I probably think it's Gohan because it turned into an ape after looking at that moon. And that moon is there to remind you of diurnal variation. And you're going to ask the patient about this. And if they say their breathlessness gets worsened when the night comes, this is because of bronchial asthma. Also, you're going to ask if it gets worsened when you lie down. Well, that's actually orthopnea. And orthopnea can be seen in congestive cardiac failure and COPD. While looking at the moon, you're also going to ask the patient if their symptoms get worse when they try to sleep. Now, this is actually paroxysmal nocturnal dyspnea and is seen in congestive cardiac failure and COPD. Then I'm going to give this monkey a party blower that is going to tell you about wheeze. And remember, all that wheezes is not asthma. Now that looks like the monkey's really celebrating after beating the ass of Prince of All Saiyans. What? Okay. Okay, so when you ask about wheeze, don't forget sneeze, because sneeze comes with wheeze. And when sneeze comes with wheeze, there are always skin lesions. And sneezing, wheezing, and skin lesions, These are the features of bronchial atopic asthma. That's getting boring. What kind of destruction is that without any fire? Let's add fire to the scene. Now that's satisfying. A fiery monkey. You know what this fire means? It means fever. And if you get breathlessness with fever, that's because of pneumonia or empyema thoracis. Next time to add a hanging injured kidney. Well, that's only a decoration piece. Well, now we just come back to the Prince of All Saiyans who has just got his arse beaten by a monkey or simply a low-class warrior, and look, see who's anxious here. That's the Prince Vegeta for you. So the shortness of breath can also be because of psychiatric problems, just like our Prince of Saiyans, and it is called hyperventilation syndrome. Okay, so that was about POD, which is just PND, orthopnea, and dyspnea. Now, just as a refresher, the associated symptoms with breathlessness can be cough, chest pain, wheeze, sneezing, fever, orthopnea, PND, or just hyperventilation syndrome or chronic renal failure. Now let's go to the park. Now it looks like this park is heavily decorated with bacterial lamps. Okay, fine. Wait. Why we're here in the park? What are we exactly looking here for? I think we're here for cough. Oh yes, cough. When you talk about the cough, you want to know about the duration of the cough, if it's long-standing or with a recent onset. If it's long-standing, it could be chronic bronchitis, bronchial asthma, or chronic sinusitis, bronchiectasis, pulmonary fibrosis, or if it's recent, that's because of tonsillitis, pharyngitis, tracheitis, bronchitis, tracheobronchitis, or just pulmonary edema. And in that case, this is flash pulmonary edema or just recurrent laryngeal nerve palsy that is also going to give you cough. Then you will ask about the onset, if it's sudden, if it comes in attacks, or if it's gradual. If we get sudden cough, that's because of acute bronchitis or just flash pulmonary edema or foreign body. If it comes in attacks, that's because of asthma or just pulmonary edema. And if it's gradual, could be pneumonia, chronic sinusitis, bronchitis, pulmonary tuberculosis, lung abscess, and bronchiectasis. Then you're going to ask if there's sputum with a cough. And yes, if there is sputum, you're going to ask about the color of the sputum, odor, quantity, character, and just relation to the posture. Now, colors, we have a lot of flavors in the sputum. It could be frothy white, that is in pulmonary edema. If it's rusty, that is in pneumonia. If it's yellowish, that is because in pyogenic infections. If it's greenish or greenish blue, that is because in pseudomonas or just in bronchiectasis. If it's brick red curd jelly, that's because of Klebsiella. If it's just like anchovy sauce, that is because of ruptured amoebic liver abscess. If it's black, this is because of coal miner's disease. And if it has blood, or you can simply say hemoptysis, then it can have a lot of causes. For example, acute bronchitis, chronic bronchitis, lung carcinoma. We can have ABPA. We can also have tuberculosis. And just like that, pulmonary embolism, AV malformation, platelet disorder, bleeding disorders. We can have mitral stenosis, or we can simply have vasculitis. After color, you're going to ask about odor. And if it's very, very bad, foul smelling, that's because of lung abscess and bronchiectasis. Then you will ask about the quantity. If there's just scanty sputum, that is seen as asthma, pharyngitis, bronchitis, tracheobronchitis. If there's moderate, that is chronic bronchitis or resolved pneumonia. And if there are tons of sputum, very large quantity, that's because of bronchiectasis or lung abscess. Going to ask about the character of sputum. Is it frothy? Seen in pulmonary edema. If it's mucoid, this is seen in bronchial asthma. If it's mucopurulent, that is seen in chronic bronchitis. And if it's purulent, only pus, you're going to see this in bronchiectasis and lung abscess. Then you're going to ask the relation to the pause. Okay, so we're going to discuss it later. Right now, it's enough. Just remember that color, odor, quantity, character, these are all associated with sputum. But what if there's no sputum? If there's dry cough, that is seen in most of the respiratory diseases, interstitial lung diseases, pulmonary fibrosis, dry pleurisy, recurrent laryngeal nerve palsy. Finally, we can enter into the park. Wait, there is an officer in the park, and that officer is showing me the handcuffs. Is everything fine, sir? So these handcuffs are going to tell you about cuff, which we have already discussed a lot in detail. I think the officer is investigating something, and that is just like this greenish discharge. And that greenish discharge is in front of the officer, right, coming through his nose as well as on his backside. The discharge that's coming through his nose is actually sputum, which we have already discussed in detail. You have to ask about the color, order, quantity, character of the sputum. And what about the discharge that is on the posterior side? Well, that's actually postnasal discharge. And this postnasal discharge is seen in acute and chronic sinusitis. Then in the park comes weight out of nowhere. Actually, this is weight loss. So if you see a patient with cough, you might want to ask about weight loss. And in this case, it's going to be significant weight loss. Now, this is seen in bronchogenic carcinoma, all chronic respiratory infections, for example, tuberculosis, lung abscess, and bronchiectasis. Whoa, 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 monkey, just hold on. Looks like this monkey has caused a lot of destruction, not only to the prince of all saints, but also to the city park. And that park is now on fire as well. And you know what that means? That means fever. So if there's a patient with cough and fever, you might think of tuberculosis and all respiratory infections. And now what kind of park is that without any tree or plant? Let's add some more. Here we draw some dandelion, which are going to tell you about dust, fumes, pollens, trees, and all the triggers of asthma. So you have to ask your patient about all these triggers, and if they are positive, including animal fur, parrots, pigeons, and all these triggers, you're just going for asthma. Next in the city park, we're going to draw a calisthenic athlete. And you know what? She is having a very different posture. So now here we're going to discuss about the relation of sputum to the posture. Now when the patients say when they turn to the one side and they have increased sputum production, that means the disease of the opposite lung. When they say they get more sputum production when they lean forward, that is because of disease of base of lung, for example, lung abscess or bronchiectasis. And when they say they get more sputum when they wake up early in the morning, that's because of lung abscess or bronchiectasis. So this relation of sputum to the posture is very important, and this is represented by this calisthenic athlete in an unique posture. Whatever is it. And now we're going to give her elastic bandage on the chest. That is going to tell you about the cardiac pain, and to learn more, you can always go to the cardiac section, where you'll find different bodybuilders in the pack show. Now, if there is chest pain along with sputum production and that chest pain is pleuritic, that is because of pleurisy due to lobar pneumonia or just pulmonary infarction. So here the character of chest pain is really going to separate different types of chest pains. If it's burning, that's because of GERD. If it's just discomfort, that could be because of pericarditis. Pericarditis can also present with pleuritic chest pain. But if there's crushing or heaviness with the positive Levine sign, this is going to be angina or MI. But still be very careful. And just as a pro tip, remember that cardiac pain can also mimic GI pain and can also present as burning pain. Let's go back to this calisthenics lady, and she is just now blowing hard. Well, that's because of breathlessness. And you know what? This breathlessness is going to take us back to the pod where we have PND, orthopnea, and dyspnea. Now, if there's sputum production along with breathlessness on exertion, PND and orthopnea, that's because of left ventricular failure. And if there's swelling of legs as well, this is strongly indicating left ventricular failure, and if there's no swelling, you might need to add COPD under your differential if the patient is chronic smoker. Now in the city park, we're going to add, oh, that's cute, a cute little baby. And that cute little baby is with the party blower. And that party blower is going to tell you about wheeze. Remember, all that wheezes is not asthma. It could be COPD, it could be heart failure, later stage lung cancer. So right now, we're just looking at the combination of wheeze and sputum production. Now, if there's wheeze with the sputum production, this could be bronchial asthma or pulmonary edema if it's frothy sputum or chronic bronchitis. Oh my god. Finally, this respiratory system is done. So very, very done. How about the recap? What do you say? So the recap is very brief. We learned about the pain in chest, cough, Now, this cough is associated with wheeze, breathlessness, chest pain, fever, postnasal nasal discharge, weight loss, dust, fumes, or relation to the posture, infection, and we learned about orthopnea, PNT, and dyspnea. So that's all from the pulmonary section.